When we are emphasizing on the mental health, because we have also come across a lot of suicide cases that are happening in doctors.
I would like to say something here. When you say, okay, doctors are dying earlier than the general public.
Yeah, we are being labeled as superhumans, but we have to always understand that we have to heal thyself. Doctors must understand that we have to focus or heal thyself, and that has to be a priority always.
For us, I think we have to do a little more research into this area.
We shall be working as a team of doctors rather than just solo doctors. We are doing it for the society.
What advice do you want to give to the doctors, ma'am?
Be happy internally, because you have become a doctor. There are many people, they are not having that sort of a thing in life.
Hello dear audience, I am Dr. Bharani, a consultant pathologist working at a private diagnostic center. On the occasion of World Health Day, we are going to talk about shorter life expectancy of doctors, and to talk about this, we have expert speakers, Dr. Manimala Rao Garu and Dr. Sonal Jain. To give a brief introduction about them, Dr. Manimala Rao, she is a well-known anesthesiologist and a critical care physician. She worked in many hospitals like NIMS, KIMS and Yashoda. She has also trained a large number of students in these areas, and she is also a founder president for emergency medicine in our country. Also, she has published many articles and also received many awards. She also got the Best Teacher Award from National Board and many awards such as Lifetime Achievement Award. She is currently working as a Director of Medical Education and Academics at KIMS Hospital. Dr. Sonal Jain is currently working at Kamineni Hospital. She is a general physician, a diabetologist and a fever specialist. She also runs her own clinic. She is focused on women's health and infectious diseases. She has also published many articles in national and international journals. She has also received felicitation from well-known people. So with this brief introduction, today we are going to talk about the shorter life expectancy of doctors. So let's start with the discussion. Hello, ma'am.
Hi.
Before even starting this topic, so basically I would like to start this with a short example, with a small example. So whenever, I mean personally when I fall sick or when I'm down with fever, for example, so my family and friends, they start judging me. So they say, oh my god, you're a doctor, how could you become sick, how are you going to treat others? So this is the first response that I hear from my family and friends. So I would like to understand, what is this general perception that the public is having towards doctors? Have you also, do you also face this kind of situations? What do you have to say about it?
Yeah, this is a very common thing, because for any doctor, when you say I am not well, they think that how can a doctor fall sick? That is the first thing. Next is, they think doctor is invincible. He's taking care of health, so he has to be healthy. They forget the doctor is a human being. He is not some god or something like that, though they call them on and off. But that is the first thing they say. You have to be healthy to treat. In a way, it is correct that we have to be healthy. So we have to take care of our health too when we are taking care of health of others. So it's a very common thing which all of us face.
Yeah, we are being labeled as superhumans, but we have to always understand that we have to heal thyself. Doctors must understand that we have to focus or heal thyself, and that has to be a priority always.
So with this, do you think that doctors are facing shorter life expectancy? Do you think that is true? Have we started focusing on ourselves, and why is, the research telling us that we have shorter life expectancy?
So as per the statistics, the lifespan of general population is 67 to 69 years age. But when we have done the statistics amongst the doctor population, it is drastically lower, maybe 10 years lesser. That's 57 to 59 years of age. So definitely there are multiple contributing factors for the reduced lifespan, like excessive stress or paying less attention to their personal health. So we'll go ahead with the discussion.
Yeah, I would like to say something here. When you say, okay, doctors are dying earlier than the general public. So, what is this research? Where did the whole research come really? It is from something like IMA Pune. They have done work. So, the doctors are everywhere. It is not on a small basis. So, I feel it has to be done on a larger scale. This is what, as a researcher, I felt when I looked at the research activities which went in. Now, if you really look at even UK or US, the life expectancy is a fairly longer only for them. And for us, I think we have to do a little more research into this area. And even if they have done this thing, like I looked at the research done by the United Kingdom, they have sort of noted down the obituary in the doctors, and then they found out when they died. So large number of people, even if they are not from UK, working somewhere also, so they have taken. So is it going to be very correct methodology? So we have to do it in some sort of a registry. We have to form every doctor when he has come into and when they died, and died due to what? Is it stress? Is it cancer? Is it something? So I think it is going to be, I think in next few years, the youngsters will hopefully take it up.
But what do you think, ma'am? Like personally, when the research will be done on a larger scale in Indian population, what do you think it's going to be? Like, can you guess, and considering the kind of stress or kind of external factors that we have, so what do you think it's going to be?
If I say, take it personally, I have lived longer and I have gone through a lot of stress. So it is not, the question is only one or two people. When you take it in a large scale, of course the total way we look at things has changed now with all this technological era which has come in. There's a lot of change. Okay. So that is why we can't really say unless we prove. I can think, yes, the doctors are having more stress, no doubt on that. So how do they manage the stress is what is important. So that is what it is going to be in the next, if they really do the research, and maybe she can start the research now and see that we develop a registry. Okay, that will make it much easier for us to say why we are having this and what is that we can prevent. Unless you have numbers, we really can't. We always say statistically significant. Is it statistically significant, or is it just our, we are thinking, yes, we are having stress. So that is what.
So there are studies done by Indian Medical Association, or the statistics maybe in few states like Madhya Pradesh, Indore, or Maharashtra, Pune, Mumbai. So they have found out that the most common factor is stress, which is leading to reduced lifespan amongst the current generation. So there are various causes per se, like chronic health conditions like coronary artery diseases or stroke or hypothyroidism, obesity, which is leading to earlier deaths. And the attention or the address of the issue by the doctors is comparatively less as compared to the general population because of the busy schedules or long working hours or so. There are other conditions like cancers which are found out to be more common amongst doctors because of the environmental exposure, like ionizing radiations, which lead to cancers of the ovaries or thyroid. So whatever the studies are done, which tend to say that these are more common amongst the doctors, and the mental health issues are also relatively higher, and which are not addressed appropriately by the doctors. So that has to be done.
And do you think this is like a recent phenomenon that stress is playing a major role on oneself, or has it been there for a long time?
The stress has been there from the time you are born. At least you don't know at that time. You are crying all the time for milk. Where the milk is coming or not, we don't know. So there is a stress for the little, the neonate, right? So the stress is always there. Stress is one way of getting things done also. So unless we have something to do, unless you have a little bit of stress, we won't do it as quickly as we want to do it. There's absolutely no stress. So the question is, it is sort of increasing in this age where it has become so much, there is not, see, in our time, we definitely had more people to talk to. Now you have got nuclear families, you have got very few people, you are living abroad or nobody is coming from here to there. So there are so much change in the way we live, and that you want to have more and more things. So naturally you have to work harder for attaining. Even the little kids, when they are growing up, they have seen so many things. The phone is there with a year-old. So you just give it, they will play with it and they get addicted to it. So this, as definitely there is a change in the lifestyle of people. So naturally with that some amount of stress. But we have not learned, because it's a shorter period, we have not learned how to overcome the steps. That is the main thing. So once you overcome the stress, in our time also we had. So for example, I'm taking a little time to tell from that time, because we only used to have 2 months maternity leave. Now we have 6 months. Okay, they still find it difficult to come back. In 2 months we had to come back. The baby is only a month, and you went for your duties. We have done that. So it is stressful. It's not that it is not stressful, but how do we manage the stress is more important in the life which we have got it now.
And what do you think, Dr. Sunal, like social media is it having a lot of impact on the current generation, or also on the stress levels that we have right now? Because I think to my knowledge,
Good and bad.
to my knowledge, no, the platform has tremendously increased to express yourself. So, and definitely that adds a lot of stress. So, like, what do you think about it?
So since there is a lot of Instagram or Facebook, it's kind of a pressure to become more socialize more and more. So few people are you are getting adapted to it, but few people are not able to cope up. So it's leading to that building of patient clientele pressure. That's always there amongst this generation apparently. I think in that generation, maybe ma'am's.
I am also on social media, on the WhatsApp, but I
Maybe
limit
10 years
it. I
ago.
limit it. I limit it. I don't. I am not there all the time. I don't care, because I have other things to do. And when you are having a little time, but that has become the norm. Then it is more stressful. That's all. Anything moderation, there is no stress. If it is extreme right or extreme left, then there will be stress. There is no doubt. That is life. Whatever you have to take it in extremes, that will be the stress.
And how does the stress affect the human body, like mentally or physically?
Yeah. As an anesthesiologist, I'll tell you, how does it affect? Surgery is a stress? Yes. So when we give anesthesia, we try and prevent that stress which the surgery is causing. They are cutting. Once they are cutting, there will be pain. The pain is conveyed to the brain, and the brain will again tell many things. Okay, you produce these stress hormones, adrenaline, and all those sort of things. So once it is produced, there will be a lot of tachycardia. There will be increase in the blood pressure. There will be vasoconstriction, and the blood flow will be little less. So naturally, all the organs get affected. If the blood is not flowing, oxygen is not coming. So that is what stress causes. And there are other good hormones and bad hormones. But if the stress will release, the bad hormones. So these bad hormones will be causing constantly. So what we do in anesthesia, we try to prevent that by cutting off that from the brain, whatever the impulses coming them, we make them sort of not conscious, not knowing about it. But even then, you can see during surgery, many times we'll see sudden tachycardias in spite of the fact that we are giving fairly good anesthesia, it happens. So stress is also like that. When it comes, how quickly it comes, and what is it causing, and what is the amount of the problem which is going to cause to the heart and the brain and the rest of the organs. We can't at one stage say, but it is sometimes it becomes chronic also. So the acute stress is bad, but chronic stress is also bad. So we have to, it's slow poisoning.
And few people adapt to unhealthy lifestyles to just reduce their stress levels, like cigarette smoking or alcohol consumption.
Or drugs.
Or drugs, So which is actually causing much more damage than resolving the problem. Maybe it is just a temporary relief, but in long term, it's a chronic damage to the body and the mental health as well.
So, and also like how often, even in your practice, and ma'am, you must have seen you must have treated a lot of patients.
Yeah, critically ill patients.
I mean, like you have everyday examples. So, how often do you see doctors approaching you for a medical advice? As in, they have some problem and they come to you, freely talk about their problem and, seek advice from you. A doctor coming to a doctor for a medical advice. How often?
So I'll go to your first question, which you said, when we have doctors fall sick, people will say that, how can a doctor fall sick? Even the doctor thinks he or she is a little invincible. They don't like to talk about their own problem to another. But the students whom I have seen, I always make it tell them that there is stress. If you are not happy, please come talk to me. Make it possible. The elders a little bit have to be a little more outgoing. So if the elders means the consultants with their students or the junior staff, if they can be a little more friendly and they can sort of tell them, if you have anything, don't worry, you can always come to me. That's what I tell all my students. Don't think your door is open, not only window, the door is open. So you can come and discuss if there is any problem. Because doctors sometimes thinks that, no, stress, this small thing I should not go and tell. They will think that. So usually they do not discuss about it, even at home. So because they are doctors, they have to listen, they have to do, they have to treat. So this is what they think about it. But it can affect any human being. And if it is too much of a stress, it can affect anybody. And more so us, because we have to treat. We worry a lot about whether I'm going to have any error I'm going to cause. Any accident can occur when I'm treating a patient. These are things all of us, whether I'll miss something, miss history for them is very important. So like this, everything becomes an important issue for us. So stress is there, whether it was olden days, whether I also faced some stress. And you work with surgeons, they want it absolutely everything correct. So you have to work with people who have got, very precision, they have to correct everything. So the stress is there in work, but then you get used to and get over that in your own methodology.
And also I have read in an article which says this peculiar word, VIP syndrome.
Yes, that's what I was going to just mention about it. So it's like very important person syndrome. Thinking I shouldn't go and seek help. Maybe there is this confidentiality limitation. They want to restrict it to themselves. In the first place, the doctors are being considered as superhumans. So that way, they're like, whatever the disease is, first they try to treat themselves by themselves. Right. Yeah. And then if there is really a need, then they approach us. This is particularly in, in cases of mental health issues. So then they try to approach the psychiatrist. Even otherwise, we have the stigma of approaching the psychiatrist in the society. So for doctors to approach a psychiatrist is a big thing, you know. So that's called VIP syndrome.
And I think, yes, that is definitely there, this VIP syndrome. Yeah.
No. I would like to just say, see, because everybody is very scared to approach a psychiatrist. Why? Because in our society, there is always the pichodu, like that. Yeah. They will talk like that. So they don't want to say anything about it. But they are forgetting this mental illness is basically because of the neurotransmitters. Whether it is dopamine, whether it is acetylcholine, there are 4 or 5 of them from the brain. And when it becomes more or less, as you age also some of them become less. So there is nothing, it is wrong with you. It is, as you age, some of the good hormones may come down. So you may feel depressed. There is nothing wrong in taking one tablet and being happy. Okay, so that is what I am trying to say. This most important thing is to understand your body. Body's physiology. As long as you understand body's physiology, you can easily make out that something is not okay. I'm not like, chirpy, I'm not happy. Then there is something is going on. So just say friendly talk with some psychiatrist. They'll tell you that maybe this is wrong, just take this medicine. It's gone and you live happy life. If you don't go, then it will be unhappy forever. That this is all hormones, and she knows, and we know, all of us know, right? So question is understanding, and not to worry about somebody is going to say something. Whether you do or not, somebody will say something. It doesn't really matter. It's you who matters.
That's a very valid point, ma'am. So, what do you think is this trend, so-called trend that, the stigmas or, approaching the psychiatrist or, approaching a doctor itself, a doctor approaching a doctor, is this kind of stigma, is it only in our country, India, or it's worldwide? So, this trend, whatever we are seeing currently.
I do not know about the survey, but if we generally discuss amongst our friends, and I believe it's relatively more in India comparatively. Like ma'am correctly said, they call us pichodu like that, labeling us mad. So that's not how it is. Approaching a psychiatrist doesn't make, not like a mad person approaching. It's basically to improve your mental health. It is always, under considered or less, under. What do you call it? I'm not getting the term.
You just brush it aside under the carpet, saying that everything is fine. Okay.
So
in other countries, actually no
underestimated.
problem.
The mental health is underestimated. Yeah.
So in other countries, they are fairly okay. They go to a psychologist, find out this is what is happening to me, and they have even from childhood, they don't have a problem. It's only mostly in our country. But I think it's slowly changing, that people are understanding. As long as we understand this is also a health problem, so that it's slowly improving now.
This shorter life expectancy, do you think it's related to the mindset of Indian medical professionals, like, Indian doctors? Because considering the system, like, how hectic it is, ante like MBBS days or, post-graduation, after, post-graduation, when you start practicing, you don't get enough break even during your practice. So do you think do you think it has any impact on the shorter life expectancy?
Well, if you ask me that question, really, when you want to become a doctor, you should have that sort of a mental frame that your life is going to be a little tough compared to many other professions. Because if you do not think about it, because time is not yours, time is related to patients, patient care, how good we are taking, all those things will come. And many times you may not even get time to eat your lunch. And sometimes you may take only a snack and then go away. These are also not very good. That can add on to stress too, because you are not taking proper meals at the right time. And another important issue is the sleep. The sleep disturbances are quite common. And of course, you see even in computer people, if they are working from here to US, they work in the night. But in doctors also, there are a lot of times there is sleep deprivation. So that is another important aspect to the mindset. So unless you have a little bit of thinking that why I am taking medicine, I want to do this because I want to take care of patients, I want to do something in the society. That you have to make it as your mindset. Then your, so much of burnout or so much of stress will not come to you, because that used to be the earlier thing. But now these are the things which have become very common, like computer sciences, engineering, medicine, and some. Now I think slowly it is, going away, because there's so many medical colleges. The seats have become so many. And even when the doctors take up medicine, it becomes tough on them to find their feet. It takes quite a number of years. So suppose if an engineer does it in about 4 years' time, he finds a job, whereas a doctor cannot do. They have to finish for 5 years, then they do the house agency, then they do the, your post-graduation, and then you do the super specialty. So many things. Almost till 30 years, you are working hard. So you don't know where you are going to go, how you are going to earn. So all these are, as stressors. So many things you are compared. See that fellow, he is earning so much, you are still here.
The competition,
The
or the
competition has
jealousy.
become tremendous.
Yeah.
The number of seats have gone up in medicine. Everywhere.
Because everyone, I think, wants to be on the top, and there is this kind of competition.
All cannot be on the top. So if a class of 100 you take, maybe about 4 or 5 will come up to the top. That is the usual thing. The rest of them, they will do well, but it will take time. So they have to have little patience if you become a doctor. So now that many of the men are not liking to be doctors. You see more women now in medicine. Okay, not in our time, it was the other way around. So these are things which are there. We have to look at it, because change of times, you can't say that I'll be sitting there, it will be done in that.
This long journey of education needs a lot of dedication and commitment. Once you join in, you are to be sure that you are dedicating 10 to 15 years of your life only for education. Thereafter, you're going to practice. After starting the practice as well, initial few years, you face this ups and downs of building up your practice, peer pressure, financial loads, you're getting married, you have kids, all of it is there. So once you enter till the end, maybe once you attain your 40s, you are quite stable, but 20 to 40 is a roller coaster ride.
Okay. So how are we going to correct this system? Like, if we say that the system as such is also having an impact, so how are we going to address this? Because when compared to a normal individual and doctors, the doctor medical profession itself is very stressful, as we are discussing right now. And also they have their own personal life. For example, lady doctors, she has her own personal life. Probably personally she is going through a tough phase. And in spite of that, there is again a lot of stress even in the medical profession. So how are we going to address this kind of issues? Because it should not be at the cost of our life. So how are we going to address this?
As I said earlier also, see, if you want to be a doctor, you have to make up your mindset on that, whether you are a man or a woman. If you are a woman, you have to a little bit of extra, because you will have a marriage, you will have children, and you have a home to run, and you have to be like a superwoman. You are expected to be a superwoman.
And there's also society pressure.
And then
whether it is a doctor or
everything
not.
in the house, you have to be looking like a good housewife. You have to, everybody has to be provided, everything. We have all done that, been there and done that. But the thing is, you will have to have some help. If they think I can do everything by myself, then it is going to be. So many times, either the in-laws or the parents, they do help. But nowadays what is happening, they are all also working. till about 60. So you may not be getting. So you have to have some sort of a help, which is important, which is difficult maybe, but you have to see that how do you do all this even before you plan everything. In those days it was easier. You could leave your child with the mom for about a year also, and then go and do your work and come back and pick them up. But it's not like that now. So you require a good help. How do you find?
And like you have earlier said, now it's becoming nuclear families, they have their own boundaries, limitations. So even I think that is also kind of adding stress to this.
The thing is, men also have changed. So they are also looking into the family, and they are also taking care of children. So you should at least thank your stars. In the earlier days, they never touched any diaper. But now they will do all those things. Okay. So what is important is collectively they have to do it together. So they understand little better now. And the women are also not keeping quiet. Okay, they say something, no, you have to do this. They are able to tell in that way as compared to what it used to be about, say, 40 or 50 years back. So this is way, slowly they are adjusting to those areas. Earlier, a doctor used to marry only a doctor. Nowadays, it's not like that. I think both doctors, it is little more difficult to organize at home. Maybe, another profession is also better where
choice.
they are not having night duties.
Right.
Like that. That's something, I think slowly the generation have shown that these are our problems, and slowly they will find method of how to circumvent them. That is important. They will do it. I don't think. But women also cannot be all the time thinking I am superwoman, I can do everything. It's not possible. So sometimes you have to really take good amount of help, be nice to people. So, in that way, I think we can be quite happy.
Yeah.
And have a little specified time for the family. Don't bring the work problem home. So that way we have to keep going. Then your burnout will be less and your mental health will be better. What do you say?
Yes, ma'am. Seeking help, that's the utmost thing.
And also, I think female doctors. I mean, I think. What do you think? It's more like worst in female doctors when compared to male doctors, because the thing is you will have to balance it at home, and also I mean it's easier said than done, because you need to again go back to your work, and then you have to talk to patients. You have to be in a stable mindset. It's not like any other profession. I mean, I'm not belittling other professions, but then here we are dealing with a life, a person here, a patient, who's coming with some problems and seeking advice from us. So do you think it's it's more tougher in women, in female doctors than male doctors?
Considering the stress level amongst the female doctors, we see more and more of PCOS cases. So because of that, we have more infertility issues. Then thereafter they get into IVFs. Then there is use of steroids or whatnot. So definitely there is an impact because of that. So health, because of rising stress levels, there is not just mental health issues, but there is also this physical health being affected amongst the female doctors, like PCOD and getting into more and more of IVF pregnancies. And there's always this apprehension because of the late marriages, this apprehension of conception, whether the woman is going to conceive, not conceive, approach the gynecologist or obstetrician for the same. So so that stress is always there, I think, between 20 to 35 years of age.
The reproductive
age group, female doctors.
Okay. And definitely I think it's more.
There is postpartum blues, postpartum depression, which is so underestimated.
Yes, that is true. People don't talk about it. And I mean, if a woman after her delivery is talking about depression or some kind of mental health status, people would not even listen to what is going on.
In the first place, the woman herself does not realize she is going through this. So maybe the partner can try to understand, or the family can try to understand, seek psychiatrist help or the specialist help, and that should sort out the problem. So mainly seeking help, family support, societal support. This is a must.
It's important.
Yes.
So for simple thing like when you have a trauma, simple trauma, you are staying at home, some fracture femur or some fracture somewhere, you are staying at home. They say after trauma, post-traumatic stress disorder, PTSD is very common, okay? And even if you stay in ICU, they say after the ICU stay, PTSD is common. So what about a woman who undergoes the whole body change, the whole of the pregnancy, postpartum? Many times they have a cesarean. Sometimes
And there are some irreversible.
So many things. The whole body changes. So does anybody give even a single thought to that? So that is also a post-traumatic stress disorder or postpartum stress disorder you can have. Okay, PP.
I think we'll come with that kind of, term very soon. I think that will be added to our books definitely.
So that is one thing. So that needs a lot of attention, a little bit of help. Women are very easily pleased.
Yeah.
If somebody says, no, you have done an excellent job, you are very good.
I agree with this point
You
totally.
will go 3 miles ahead to do something more.
She just
So
needs
it
a
is
bit
just
of appreciation.
little appreciation, not saying something. No, you can't do that. So that's not the thing. If you just appreciate, and it makes wonderful things, either from the parent or the siblings or the husband. You just tell in that time they need a little bit more.
Yeah, right. And ma'am, do you think that this shorter life expectancy? Do you think only certain specialities in medical profession are facing this, or is it generalized? Like,
See, earlier most of the specialties were stressful. Like even if you take anesthesia, it was very stressful at that time because we didn't have anything. But now anesthesia, the mortality has come down, the monitoring has improved, anything. But still it is a lot of stress because the long working hours, cooped up in a area where you are not going out, you can't go. So these are some of the critical care. It is also stress. So if you have got emergency medicine, it's supposed to be highly stressful specialty now. Even abroad, they have found that the emergency medicine has got more burnout compared to many other things because they are seeing so many sick patients. They come and they are the face of the hospital and they have to do very well. And the relatives are very highly emotional. So things can go wrong even if you do a smallest mistake. They cannot take it. So these are where you cannot commit even a single mistake. These are the areas there is stress. Surgery is also, but nowadays with so many things with gadgets and all, it has become better as compared to earlier. Now you can diagnose better. Earlier we never had X-ray, we didn't have. Now they will write CT scan. So these are all the things which have improved. Ultrasound has become part of our diagnosis in ICU. We just diagnose everything there with the ultrasound. So we have become radiologist and allologist combined there. So this is, but it can give you stress. So that is what it is. And communication. I think if you are a good communicator, your stress is less. So anywhere, wherever it is, if they can talk to the other person well, project whatever you are thinking, then ask them what is that they want to. Then once the communication is clear, then the stress becomes less. People tend to forget that. So if you communicate, suppose somebody told you something, then you have done the job. If you get back to them and saying this is over, then there is no stress for both. This is the thing. So, but because of the time, whatever it is, they find it difficult. Now it is becoming more to write on computer. So it will be EHR now. That is
it
also,
has its own pros and cons.
That is also going to be stressful in the beginning, but they'll get used to it.
Because when we see, now with the social media or with the technology, patients, they start googling everything and they come to us. And
that is the main stress now.
main stress,
the main stress now doctors find.
And it is so difficult to convince that convince them about the problem. It is becoming very difficult. So because they are learning everything through Google and they are coming and having this discussion and they are telling us to what medicine we have to prescribe. So that is one of the stressful factors.
No,
It
that's
is
what they
kind
have
of a
to-
stress amongst themselves, the patient themselves, and also the doctors to convince them or to teach them.
Right.
Yeah.
That is the
See, it is particularly when they are very sick. Like we see very sick patients in the critical care. At that time, they are very highly emotional. So most of the time, a little senior person is to talk to them and tell them. First day, they will not listen anything what you are saying, but slowly they will understand once they are talking to us. But it is mostly how you put it across to them. We know that they are very stressed, so we have to tell that first. I know absolutely it is a terrible thing happened. Something like that you have to start, okay, and then slowly get them onto our side. Okay, Google will say like that, but this is what I have seen in my practice, and this is what is happens in this hospital, and what all Google says, like in social media, it's not right. It will give you the gist only. So if we explain to them, many of them tend to listen. But you have to have a little time. Patience and time. That is important. That is also not there. Then you get into more problems.
They should also stick to these qualities of empathy and compassion.
Yeah, that
doctors.
is very important.
Yes.
And Dr. Sonal, when you come across, your probably, doctor friends, female doctors, do they talk about, balancing their, talk about their lifestyle? Because all the time we are only talking about treating patients. But are we looking at ourselves, looking at how we are becoming, how stressful we are becoming, and it is having an impact. You being a diabetologist, you must be seeing doctors, there's a lot of obesity also in doctors. They don't take care of themselves. They skip medicines. Because I have some of my friends who are like very good doctors, who are treating patients every day. They do research about, what medicine should be given, and they come, they are all updated in with regard to the patient. But with regard to, their own health, they are kind of, backing off. So how do we, what kind of suggestion would you give? How important is it to, balance this? And how do you balance this?
So, because we have been discussing, because of the long working hours and the sedentary lifestyle, because it's more of a desk-bound job, particularly for the physicians or clinicians. So there is a lot of reduced physical inactivity, which thereafter leads to this chronic health diseases or the metabolic syndrome, which includes hypertension, diabetes, obesity, hypothyroidism, coronary artery disease, stroke, whatnot. So all this is basically because of the sedentary lifestyle, or eating a lot of junk food, not exercising on a regular basis, or few people are, if they are addicted to smoking, alcohol. So this is there amongst doctors too. So this has to be addressed. So you have to pay attention to your physical activity, your eating habits. Try to stick to maybe yoga, maybe 30 minutes of exercise every day, just brisk walking every day, 5 days a week, take 2 days off. So that also should suffice. So maybe just the diet and exercise part has to be like a norm. It has to be like part of your daily routine. Then things should fall in place apparently. Yeah.
Many times they can't do it because of their this thing. So what is most important is once you start your day, you can't do it. So do it before you start the day. At least an hour before you get up, because it's for your own good you are doing. So it is important that you do some exercise. Eat in a moderate way. Don't eat junk food. I know, because in between, as I said, some snacks, they don't eat anything. Then they eat some samosa.
And they don't manage timings. They don't eat on time.
So these are the things which can also happen. And sedentary for at least physicians if they're sitting at that. But for us, we'll be all the time walking around. So that is one good thing in critical care, anesthesia, emergency medicine. We can't get time to sit anywhere. So that is one good thing. So, but now and then, you have to sit to, relax a little. Then have a hobby. Whether you want to write something, you want to paint something, you want to listen to music, at least keep 10 minutes or 15 minutes for your own sake of doing that hobby. That makes a lot of difference. These are small things you incorporate into your life from the beginning, then it becomes, a norm. That is what they tend to avoid, that in the beginning. You can never do it afterwards. It's in the beginning when you are between that 20 and 40. You should start doing that at that time so that you will continue to do.
So, for this, what do you think are the causes of early deaths in doctors, especially?
I think we have discussed quite a few times. If there is early death, it should be mainly with the stress, or it could be genetic. We don't know. Then some people will be having some genetic tendency, or could be due to cancer. So we don't know who gets what gets. And other thing is the stress, which can cause a lot of mental health problems. And then this stress can lead on to a lot of things, as she has also said, PCOD, later pregnancies, this one, post, this stress disorders which can come. All these can lead to little early death. The other thing is, ours is a diabetic capital of the world.
Yes.
Okay? Basically, ours diabetes is much higher. And once the diabetes sets in, they have to take a good care of themselves. To prevent it rather than to treat it is actually the doctor also. But doctor will always get to treat. And we also try to prevent and tell them don't smoke, don't drink, don't have, all these things. It's done. But the problem is, are they following? We cannot, it is individual. See, they have to follow, saying that they will have a life not too sedentary, and they will have good habits, they will have exercise. All these things will prevent stress. A moderate type of eating, not too much of junk food. All this will prevent. And also the children also, and have a good family bonds, excellent communication with the family, take care of things, and have a little extended family, have great communications with them, go out with some people whom like, have friends. So these are important besides your work. Yes, as a doctor, you are very much concerned with your patient. You can be called anytime, in the night, day, or anything. They'll send you bunch of WhatsApp, this thing. Then you have to keep on increasing the size and see. You won't be. Then even before you see, they'll call and say, "Have you seen it?" I'm sure you're having that.
Yes.
So these are all the things which will cause stress. By the time you ring up, they call. And as we said, the Googlers. So all these things are causing stress for them. In our days, this sort of thing, the doctor was respected quite a lot. But now with all this corporatization, a lot of, non-ethical way of practicing, or people do not really look at them, listen to them. So these things are causing the doctor's image, come down a little in death. So if you communicate well with a compassion and ethically, that is what they have to again rebuild those things. I know it is tough in the present era of politics and how the, money making goes. But still, I think we can still do a good job. If you are a good doctor and you listen to them properly, then you will have a better this thing, and explain to them. Listen first, explain next. These are the two things makes you a good doctor. Watch them and think about their, improving. Then you take care of your self-care. That will prevent most of the problems which we are facing. That's all.
So, if I say you have asked causes, if you shortlist, number 1 cause is atherosclerotic cardiovascular diseases. Number 2 comes cancer. Number 3 is infections in association with mental health issues. So, stress is always there, and it is just aggravating these. And infections, we know we are more prone for infections, doctors per se. So, appropriate precautions we have to take, like lifestyle modification, exercise. Like this thing, the basic thing which we always keep telling, wearing mask, face mask. So that can prevent more infections. If you're immunosuppressed, it could be in any form. It could be diabetes itself is an immunocompromised state. So take timely medication. Do not skip the medication. Timely meals is a concern amongst the doctors because of the long working hours. They just because of the duties, if it is among the residents. They skip their meals, they skip the medication. So that has to be addressed. So they have to make sure that they are eating on time, taking their medication on time, giving time for physical activity, avoiding a junk food, avoiding cigarette smoking, avoiding alcohol. Wearing, like I said, already said, taking appropriate precautions at the hospital. That should suffice. That should suffice in improving our physical and mental health.
And when we are emphasizing on the mental health, because we have also come across a lot of suicide cases that are happening in doctors. So what do you have, you have something to say about like what could be the cause and, the stress again?
So the long journey of education itself is one factor. Then the peer pressure. Right. If you're not getting appropriate peer support, whether it's from your friend circle or from your teachers or the management system, then you break down.
Even family. Sometimes they
family,
don't tell
yes.
anything to the family, they don't understand.
So maybe making, seeking help is one of the things. Seeking help from your family, friends, if need be, the psychiatrist. That should help. And maybe the society should understand all of this, take into consideration, and build appropriate work atmosphere for the doctors. Maybe work on the working hours of the doctors. It has to be nothing more than 8 hours a day. They cannot work for 24 hours at a stretch, maybe all throughout the week. That's not happening. The working hours amongst the doctors are nothing less than 60 to 72 hours in a week. So that's quite more. I mean, comparatively, if we compare, like you were asking about the other countries, they have this fixed routine, 8 hours a day and 5 days a week. That's it. We do not have that system. Maybe Indian society can also work on that.
The working hours, at least for the residents and all, earlier compared to earlier, now it is little better, because we always, if they are coming on duty, they are coming at 5 and then they continue for the next day. Then they go at about 9:30 or 10. Earlier it was not like that. So it was continuously you have to do till next day afternoon when you started your morning. So it is okay. It is slowly coming there. But usually in these areas which are very, very intense, they do have a little bit of shift duties. So in that way also it is helpful. They are slowly improving those things. But the doctors themselves have to understand theirs is also a human body. There is a physiology inside. Every cell requires oxygen and glucose. So for that we have to work in a proper perspective. That is the idea, and you have to think in that way. And if you don't think, then all these problems.
We also need to have our own set of limitations and boundaries.
And this thing. So suppose if you are having a time, you have to go at 9 o'clock. But if you start at 9 o'clock, you will be there only at 9:30. So for that, you have to start at least at about 8 o'clock. You have to do the time management or the time discipline. If you are a lady, then you have to keep everything ready. Maybe an hour or two early, you have to get up and do things and then move. So then you do not have the time stress on you. Next time is a system. You have to be a systematic approach in both life and at your workplace. If you work with a system in the work, then there is no problem for you. If a patient comes, you are asking from the history, then you have to go clinical examination. Like we used to be called as inspection, palpation, percussion, and only auscultation. So this all, if it is done in a systematic way, there is no problem. Then a little proactiveness. If you are a little proactive, think, okay, tomorrow how many patients I have given, how much time it will give, think about it, what type of patients may be there. If you think a little in an organized way, a systematic approach will definitely help. And have a discipline. And you have your own mental and physical discipline that you want to this way. And suppose if you are a diabetic, you have taken that one and you have to take after lunch or just before lunch, you think about it. Just keep those sort of things and have that. You do it about 1 month, it becomes automatically a norm for you. Okay? And the most important thing is communication. Have a good communication. Don't get aggressive. We don't have become aggressive to, trod over somebody else. We will do our best. We will have ego to do our best. That is ego. You have to do it to the best of our capacity. Don't have ego for showing off. No need.
Actually, I was coming to that point, ma'am, because you are also the head of the department and you have trained a lot of doctors. So, students, so I mean, like, in your own words, if you can just tell the rapport that you have to maintain with, the doctors, the students, I mean, and I think that would actually take care of a lot of problems, having that kind of mindset.
The main thing, because you brought it out, many times people are a little scared of me. One. But the scare is only to get the work done. The scare is not to improve them.
Yeah.
So if you want to improve them, they have to do it in a systematic way. And I must see that they learn it in that way so that tomorrow they do not have a problem in their life or in their career. But I always used to tell them that you must come, and if you have a problem, let me know.
Right.
Let me know so that I can help you. Even simple thing like they don't talk. So I always make there 2-3 types of students. One is highly egoistic guy or a lady who will think they know everything. But they have come here to learn. So they have to learn. So they bring them down a bit without their realizing that we brought them down. Second is the middle level. They will learn. The one more is just they don't talk. So you make them talk and come with the whole lot of people. So these are the type of people you get as a teacher or an educator in all the things, whether you are a doctor, whether you are anybody. So you see that they should not feel unhappy to come to you to tell anything they want. That door should be of communication should be open. This is very important for all the HODs. If you think you are only HOD, I will only do this way, they have to do that way, it doesn't work. Nowadays it's all the more. You have to be little more benevolent to find out what is their problem. Listen from their side. You can't take unilateral decision. Both sides you have to listen and then solve a problem.
And that will also reduce the stress.
Reduce this disturbance of their mind, that they know that they can go somewhere. Whether it is whatever, it may be ward boy, it may be a nurse, it may be your student, it may be fellow doctor. We have to communicate. Don't judge by what others say.
Yeah.
So that is important.
That is very important. Rightly said, ma'am. In a nutshell, like what advice do you want to give to the doctors, ma'am?
I've already given it.
I mean, in a nutshell, briefly, if you can just just conclude it.
One thing is, be happy internally, because you have become a doctor. There are many people, they are not having that sort of a thing in life. You have become a doctor, you can do a lot of things to people. You can propagate this one, control, a disease. How well our doctors worked during COVID. It was appreciated all over the world. So when we are having that sort of a thing, when you are able to be productive to a good health, then you are having a very good beginning. So keep that, be ethical and be, compassionate to people. Find out from them, listen, communicate well and tell them what you do. Unnecessary things don't do. And then don't feel jealous about somebody else becoming, higher. You do your best.
I think that is very important,
Yeah.
ma'am. Like, it's not always about you. I mean, you do your thing, let others also flourish in their own way.
That's it.
Yeah.
That is the thing. So, if you are happy, and then now and then at least have joke, nicely
Correct. I
smile.
think that is missing
It is
a
very
lot of
important
times.
that you have to smile.
Smile. And you can be
So,
casual.
Yeah, casual and be nice.
Yeah.
And do a little, if you want to, you get a little time. You do something for a poor people, Suppose if you get 1 or 2 arrogant people, be nice to them. Find out what is their problem. Then it feels happy that you are doing something, and that itself will make your mental stress go away. This
And
is what,
amongst the medical fraternity, reduce this cutting down of egos, jealousy,
Yeah.
unhealthy competition. It's not helping. So for our own good, we have to correct
I think
that.
even it is helping, it is only temporary. If they are feeling that it is helping, I think it is only temporary and not on a long-term basis. Yeah.
So we shall be having a teamwork. We shall be working as a team of doctors rather than just solo doctors. We are doing it for the society. So let's be like united, stay united. And for any help, we shouldn't hesitate to seek help from your co-doctor. Yes.
Suppose, see, in a team, if you've got so many people, well, if she's working solo, maybe in the hospital at the clinic, but she needs a pathologist, and she needs a lab, she needs a radiology, she needs sometimes maybe in surgery, anesthesia, or sometimes they will require critical care. She will send to emergency. So all this is our team. So if you look at it as a team, the team wins.
Everybody
It's not
wins.
everybody.
Yes.
The team wins.
That's important.
That is the crux. If you should be able to draw everybody, talk nicely, and say you are important. So many times they tend to forget, and they feel very upset, and they just leave from there. Okay. So this is important for us. The team wins. So that's motto.
Very nicely said. And your advice to the future generation, ma'am, who are willing to, join medical profession in just to conclude it briefly.
If you really ask, if you really like to help people and you want to work hard, and the first 20 years you are going to work hard, then take medicine. You have to be really there to help people, but you have to first get a name. For getting name, you have to really work hard, and that hard work and compassion to the patient, and that patient will bring another patient. That is your marketing. The patients market you. So you be nice to them, they will bring.
And I think in that process, we should not forget about,
Our
taking
own health.
care of ourselves. Yeah.
No, if you are not okay, you cannot take care. So you have to take care of your own physical and mental health.
If
Don't
you
fall
just
prey.
say it in a phrase, eat healthy, stay active. Yeah, I think that's the phrase we should.
Don't miss joy in life.
Prevent rather than treat.
Yeah.
Repair rather than repent.
That's a very beautiful way of concluding it. Thank you so much, ma'am. Thank you. On this World Health Day, we as doctors, let's take a note to not neglect our physical and mental well-being and be ready for stretching that helping hand to our fellow doctors, and more so if it is female doctors. So let's build this healthy work-life culture for ourselves and for the future generation. And I would again want to thank Dr. Manimala Rao Garu and Dr. Sonal Jain for giving such a wonderful talk about shorter life expectancy in female doctors. Thank you so much.